So we have two final speakers, which, as Susan said right at the beginning of the day, Susan McVie said it right at the beginning of the day, are somewhat different from the earlier ones, but they also bring together some interesting implications, I think, of many of the talks that we've had today. First of all, Stephen Marwick from Evaluation Support Scotland is going to talk about the role of this kind of evaluation for the voluntary sector, and then Rika Eversholt will talk about data visualization. So Stephen, first of all.
Thank you. So we're back to Scotland now for the last session from Evaluation Support Scotland and then IRIS. Evaluation Support Scotland is an organisation, it's a voluntary organisation and it works with other voluntary organisations, and we're helping organisations to measure their impact and do their own evaluation and make sure that they can use that evaluation to improve their services. And it's become increasingly important over the last 5 or 6 years for the voluntary sector to be able to evidence the difference they're making. Their funders are asking for it, they want it themselves, so they can improve their services, and also because there's an opportunity to use learning from the voluntary sector to influence policy and practice more broadly. So that's why we exist, and that's really what I'm going to talk about. Specifically, I want to explain how the voluntary sector can evidence its contribution, given that most voluntary organisations are extremely small, with no or very small numbers of paid staff, and do not have access to data sets that mean anything for them at their level. I'm going to talk about the role of self-evaluation, and I'm going to talk a little bit about how data can be used for decision-making in policy and service design. Now, we work with people in organisations who do not come to work to evaluate, so it's important for us to make evaluation fun. So I will try and make this presentation fun, and you're allowed to laugh if you find me funny. I'm going to start by talking about showing contribution, and as Louise alluded to in her presentation right at the beginning of the day, we now work in Scotland in the context of the National Performance Framework, which says that government wants us all to be healthier, wealthier, greener, meaner and sexier, or something like that. The question is, of course, how will we know that we're healthier, wealthier, greener, meaner and sexier, and particularly how will a local voluntary organisation be able to demonstrate contribution to that? In addition, Louise was talking this morning about the 4 pillars of public service reform, that was people, partnership, prevention and performance, and the voluntary sector needs to be able to show contribution to those agendas as well, but also has a story to tell about how to think about prevention and performance and partnership and people. So to help us think about how the voluntary sector is doing that, I'm going to introduce you to Roger, the Regeneration Rooster. And he works in Easter Hen House. And he's got his work cut out for him because he's got a problem. He's got unhealthy hens who've been eating unhealthy scraps and are seriously overweight, and he's got feed of crime because the Easter hen house is very unsafe due to feed of foxes, and also chickens are leaving their nests without even the rudimentary clucking and pecking skills, so they would not score well on any of the criteria that we saw earlier. So Roger needs to work to solve these problems and prevent them in the future. And to make matters worse, here's Daphne Duck with guidance for the new fowl outcome agreement, which Roger has to contribute to. And he has to deliver healthier hens, smarter chickens, safer and stronger flock, and of course, sexier Roger. Now, like many voluntary organisations, Roger knows he's doing good work, but he's no idea how to prove that he's contributing to high-level change. And the problem is, he needs to be doing this by the 31st of March, like the rest of us. Daphne Duck needs results right now, or she'll turn the whole place into a battery farm. However, the good news is, I'm here from Evaluation Support Scotland to help. Now, as we know, Roger is not alone. As this cartoon illustrates, we're all in the business of saying we're doing stuff to achieve long-term change, and somewhere in the middle, good stuff are going to happen, and we don't quite know how to evidence that. And that's why, and we've heard this throughout today, theories of change are seen as one way of solving some of this problem about how we design and describe the miracle. And as we've already heard, one way of thinking about theory of change is logic modelling, which is very much the latest craze. Everyone is logic modelling. There's barely a person in Scottish Government who isn't now. And it's a bit like breakdancing was to urban youth in the 1980s, which is that it looks really good, but it's very hard to do and it hurts your head. it, of course, is not evaluation. It's a planning tool, as Erica explained this morning, but it does show or challenges the logic underpinning a plan, and then also it gives you a pathway against which to evaluate. Not just what to evaluate and what outcomes you're looking for, but also, more importantly, the assumptions that are underpinning your theory. So we use theory-based approaches very much in our work with the voluntary sector. Here's an example from a slightly made up, although based on reality, community health project, which is working with communities in deprived areas who are suffering from a lack of healthy eating. And they're running cooking classes, providing access to low-cost food, sending messages about healthy eating. And it's important for them to do a couple of things. First of all, to think about the problem that they're trying to solve. That's really important, otherwise you end up with a logic model that solves the wrong problem. And in their case, the problem is rooted in research that we already have about the barriers to healthy eating, which are fundamentally around accessibility or lack of accessibility, lack of affordability, cultural and skills issues. So their intervention is designed to address those issues, and then they have a theory of a chain of outcomes that they're looking for and they can evaluate against. And as a small community project with just a couple of paid staff, they cannot evaluate whether people are not dying of heart attacks in 20 years' time, but they can look to see whether the early stage outcomes of increased skills and changed behaviours are coming together. So going back to Roger the Regeneration Rooster, what would that mean for him in Easter Hen House? Well, he would come up with a couple of short-term outcomes, which might include increased free range for fat hens, which might lead to better health, and increased awareness of the value of clucking and pecking for the chickens so that they can do this for themselves. The important thing for Roger and for all of us is that we don't just look at the outcomes we're trying to achieve, or indeed what would have happened anyway, as we've heard already, but also what might be unexpected negative outcomes of the work that we're doing, and we need to build that into both our evaluation and our delivery. So, for example, it might be the case that free-range hens brings them into contact with those foxes we were mentioning earlier and might result in an unexpected negative outcome for the chickens. In a more human example, working, for example, to increase someone's income might help reduce their poverty, but it might also give them money that they spend on drugs or give them an illusion of financial security that they don't actually have. So it's important to build in activities to address your anti-theory and also evaluate to check whether you're not achieving those negative unintended outcomes. One of the bits of work that we've been doing with funders of the voluntary sector is to make sure that we understand why we're doing evaluation. And the funders of the voluntary sector who come together in the Scotland Funders Forum are saying that it's important for them that evaluation be valuable, relevant, proportionate, supported, and involve internal or self-evaluation as well as external evaluation. And so that brings me on to my second point, which is about the role of self-evaluation. Now, mostly what my organisation is doing is helping organisations to evaluate for themselves, and so that's self-evaluation. And we want people to do that partly because it's cost-effective and flexible. If you're a small organisation and you don't have time or resources to commission someone to do the evaluation for you, then it's important that you be able to do something yourself. But also self-evaluation can give us a rich source of evidence about how and why change happens or doesn't, not just whether it happens. At best, self-evaluation can complement formal research, and I'll say more about that later. But most importantly for us, and I think there is evidence for this, that if you're doing the evaluation yourself, then you're learning yourself, and learning is embedded within the practice of your work. And so it's really important that people are actually questioning whether what they're doing is making a difference through their own evaluation. Now, our experience, when Evaluation Support Scotland first started, we thought we might be signposting lots of organisations to existing evaluation tools. There's hundreds and thousands of them if you go on the web. But in fact, in reality, what we've done a lot more of is helping organisations to build evaluation into their day-to-day activity, because we find that when evaluation is shown as a separate activity, it doesn't happen, or it's perceived to be dull, or it runs against the day-to-day work. People don't have time to do it. So it's important to find ways to build evaluation to day-to-day work and also day-to-day work into evaluation. And you have to be quite creative about that. So for example, you might tell me that you're doing evaluation and you show me a questionnaire that every service user is filling in, and I see it's asking me, are the staff nice and is the coffee palatable? And I'm saying, yes, well, you are lovely and the coffee's delicious, but really drop the questionnaire and walk away because it's boring and it isn't telling you about what difference you're making, and I'm going to destroy it, and you should look around and see where else you might be collecting more useful information. And so we're in a community setting, and there's a bunch of parents over there who are meeting every week, and actually they could be a focus group to talk about the difference that's being made to their lives. And a lot of voluntary organisations do one-to-one centred, person-centred planning. So if they did that, they've got progression data that they're collecting anyway. And here's some service users with low literacy levels who could never fill in that questionnaire in the first place, but they've got experience of using video work or drawing pictures, and so we can create much more creative ways of gathering information. So a lot of what we are doing is helping people to rip up their boring questionnaires and thinking about more creative ways of collecting information that helps them show the difference that they're making. Now, of course, what you might well say, and other people say, is that self-evaluation is near a bust. We need to do it properly. We need to commission external evaluation. And here's Roger commissioning robust quantitative methods and randomized control trials and experimental designs and reversing the polarity of the neutron flow. And all of that is great, except that all too often it ends up telling us that Roger's doing a good job, but he needs more funding and a bit clearer plans. And really, that doesn't actually tell us very much at all. And the evaluations are often filed away and put on a shelf and never seen again. And that's because, in our experience, evaluation needs to be a process, not an event. It needs to happen all the time, and it needs to help reflection and learning. So this is not saying that there's no place for external evaluation. Of course there is, but it works best when it complements self-evaluation and where the external evaluator is not actually required to collect a lot of primary data, but actually has some data that they can analyse, they can set against formal research, they can do more interesting work with, as I'm sure the external evaluator in the audience will tell us. It's also helpful for us to think about how self-evaluation data can add to and sometimes even conflict with the formal research base. And we've been doing some work with the play sector, so organisations that are supporting parents and children to play. And you might say, why do we need organisations to help play? Well, it turns out that children are not playing now because of cultural changes to do with stranger danger, health and safety, lack of spaces to play, parental attitudes, schools, and so on. And so the benefits that children get from play are being lost because opportunities for pre-play are not happening. So a bunch of organisations are helping that to happen, and then they need to evaluate the impact of their work. And what they're gathering is some very interesting data, some of which adds value to or confirms the published research. But one example that they were coming up with was saying that children who are playing are behaving better in the home, and parents are reporting that the children are easier to their behaviour is better. And actually the formal published literature says that that isn't the case. There's no evidence for this. But the voluntary sector organisations were saying, no, really it is. It's not anecdotal. We've got substantial evidence, and we can build on that, and we can maybe say in what circumstances and how and why. And so there's an opportunity to add value, I think, to the published literature about what works and why. And why that matters is because, for me, evaluation should be about learning what works for whom in what circumstances and why. Erica described a number of purposes for evaluation, all of which are important, but I think what we're focusing on specifically in our work is the learning outcome from evaluation. So that brings me to my third area, which is how we might use evaluation for decision making and why that's important. Now, one of the things that we need to think about is how evidence is used and what kind of evidence you want in the first place. Iris has been doing a lot of work around how to make evidence meaningful for the the people that might use it. And we need to think about how people like evidence. So is it other practitioners, or is it policymakers, or is it your funders? And we all have different attitudes about evidence. Some of us want our evidence poached. We might take it from other sources. We might want to pull evidence together, maybe even contradictory evidence, and put them in one place. A lot of our evidence might be scrambled. We don't really know what it's telling us. We might want hard-boiled evidence. We just want the facts. The minister just wants the numbers. He doesn't want to know the stories. Or maybe we're just so exhausted with all this information that our brains are fried. Or we maybe want a mix of methods. So there's lots of different ways in which we want to present our evidence, and it's important to think about who it is that we're presenting evidence to. And also how decisions are made. And I think we all know that it would be naive to say that all decisions are evidence even informed, never mind evidence-based, and a lot of times decisions are made on the basis of the last person that you spoke to. So it's useful to think about how much evidence do we need to inform a decision, because actually decisions are made for all sorts of different reasons. Well, for that reason, we like this model, which comes from Erica's colleague, Andrew Tannahill at NHF Health Scotland, and it presents a triangle. There's lots of geometric shapes in evaluation. Here's one example of one, in which it says that Andrew Tannahill is saying that decisions are often drawn from three different places. There is evidence, research, and formal evidence at one end. There's also plausible theory at another place, and then there's ethical principles. So particularly if we want to help Roger the Regeneration Rooster to reduce the weight of his chickens, we might be wanting to introduce rationing. That might be the quickest way to actually tackle obesity, but actually that might not be ethical. So we actually have a range of different factors that influence our decision making. And we're particularly interested in the plausible theory bit of this triangle because it helps validate and say there's a place for self-evaluation evidence from the sector, which is based on practice experience and can be added to the other aspects of the decision-making triangle. Just to give you a couple of examples of that, a programme called the Partnership Drugs Initiative, which is funded by Scottish Government and the Lloyds GSB Foundation for Scotland, has been funding for about 10 or 12 years projects in the voluntary sector who are providing support for young people at risk of substance misuse. One type of intervention they fund is intensive support to young people. And the literature tells us that a therapeutic approach that provides one-to-one support to young people with at risk of low risk of substance misuse can be effective. But what the literature doesn't really tell us is exactly how that intervention should work. So what we've identified from about 10 years' work with these projects on the ground is a lot more information about how long the intervention needs to last, how much money it can cost to run this intervention, what the caseload should be for the individual practice worker who's providing the support, what the referral mechanisms are, and also the differential impacts of a holistic approach where you might have diversionary interventions going alongside versus interventions where it's simply the one-to-one support. And all of that has really added value to what we already know from the formal published literature, based on practice learning, I suppose. Another organisation that you may have come across, and if you haven't, I would urge you to log onto their website, is the Long-Term Conditions Alliance, and they provide support to projects that are working with people with long-term conditions, arthritis, MS, and so on. And they've been doing quite a lot of work that's been drawing up evidence from on-the-ground work to identify common themes to promote the value of self-management, in other words, individual people with particular conditions managing their own condition, which has a consequential positive impact on resources spent by the NHS, as well as, more importantly, benefits to the individuals themselves. And LTCAS has found ways, very creative ways, to showcase those themes that have helped policymakers and politicians understand what works and why, really simply, in ways that we'll see more examples of from Iris in a moment. Just as I'm coming to the end, one last thing I want to draw attention to is that one of the factors which helps create the use, hinder or help the use of evidence by the voluntary sector is the demands placed on them by their funders. And so we've been working with the Scotland Funders Forum again to try to identify practical steps that funders of the voluntary sector can take to make reports more useful for them and reduce the bureaucratic burden on organisations who are often finding themselves reporting meaningless information information to their funders, and maybe lots of different meaningless information to lots of different funders. And so we've got a number of simple tips which funders are now implementing to try to make the process of reporting to their funder more straightforward, but also, and more importantly for this audience, more focused on outcomes and what works rather than just what we did. So to conclude, I suppose our learning in a nutshell from our work with the voluntary sector is that theory-based approaches are very helpful and useful in terms of helping the voluntary sector to work out what to evaluate and when and how and what matters. That it's important for hard-pressed staff and volunteers to build measurement into their practice and practice into their measurement. In other words, thinking about the way that they do their work and the way that they do their evaluation being complementary. That measurement needs to be valuable, relevant and proportionate, and thinking about how much evidence is useful for the different audiences, and focused on learning. And I want to finish with a slide that shows that it's often just as useful to know what doesn't work as what does. Thank you.